When we have patients that are a bit older, it causes us to think a little bit more differently about how we're going to place and load our implants. We know that the age of our patients, the life expectancy is increasing, and so we can't treat a patient who is in their late 70s and 80s always the same way that we can in a patient who's in their 20s and 30s. That last patient was 32 at the time of implant placement. And so can we really modify our treatment, and do we have some objective ways to think about that in our older patients? So we know that advanced age is related and associated with many medical risk factors, some of these being osteoporosis, cardiovascular disease, and of course an increased number of medications. Most studies don't directly correlate advanced age itself with increased surgical complications, but again, more elderly patients are going to have more medical risk factors. There are some studies that show bone in terms of looking at bone quality and quantity, and this is an animal study that showed less trabecular bone surrounding implants and decreased bone to implant contact in older versus younger rodents. And so, obviously this is a rodent study, but, it would make sense, and we know from, many of the medical studies with osteoporosis that our trabecular bone does decrease with age, and our trabecular spacing increases with age. And then, of course, that we know that the ISQ values are higher mostly in men, mostly in mandibles, and in denser bone rather than soft bone. All of these things that play a role when we're thinking about patients. And so this is a patient of mine in her mid to upper 90s, and I had done quite a few implants on her over time, starting when she was 92, and the last one was when she was 97. And so this is not a patient that we can think of in the exact same way as someone who's in their 30s or 40s. And so this is a tooth that had fractured that she had lost, and I think she was 92 or 3 at the time. And she said, can't you at least help speed up the process? Can't we do an implant immediately? I know that, you're not going to be comfortable putting a crown on this tooth, but can we at least place the implant at the same time? And so, of course, she said, well, since I'm already in my mid-90s, my time is a little bit limited, and so these 4 months or 3 months does make a difference to me. And so how can I determine that? Well, when the tooth is extracted and we place the implant in, I did place the implant at the time, and this is the site healed, and she had a 56 reading of the implant. And so certainly not one that I would want to place as a one stage or even consider loading immediately, but we gave it some more time to heal. And of course, at the time of uncovering, the ISQ value did increase. It went to 65, which is not, a huge number, but certainly an improvement over the 50s that I saw at the time of placement. And so this gave confidence to go ahead and then do the implant crown, and she's done very well, and she's had this implant for about 5 years now. And, of course, this, as I said, I don't really know that whether or not I had a 70 at an immediate implant placement and someone who's in their mid-90s, I would have immediately loaded it. And obviously it was even a little lower at the time of placement, so showed me that I wanted to do a 2-stage placement in this patient.